This movie is an introduction to the current state of UniGuide program, working with three different modules. One is U Treat, to treat the images coming from the CT scan, to import these images. The second one is U Plan, to plan implants. And the third one is U Design, to design your surgical guides. After designing the guides, you can export them to make them fabricated by UniGuide or by your dental technician if it is registered. So let's try to open a case. I go to New Case. I choose a case. On the lower, I have the history and I can easily find out my older cases. And here I have the number of images included in each DICOM file, so I know what DICOM file is good and which DICOM file should not be used. So I open Caesar, I double click, and immediately I get the image. This is the sagittal image. I can slightly reduce the height so that I can get an image which is a little shorter. I can do the same at the back. And when it's done, then I click on mandible and look how fast is the process. I go to the treatment of the 3D image and the 2D image. So this image appears in 3D, and this 3D is a volume rendering. This means that it's a cloud of pixels in space, and this will allow us to place an implant in this case, but if we want to fabricate a surgical guide, we need to get a surface rendering, and this is not a surface rendering. To make a surface rendering, we need to segment the objects and to prepare them in a surface way. So I can draw a panoramic curve. I just click 1, 2, 3, 4, 5, double click, and it's done. So if I want to change the position of my line, I just do like this. I slightly change this, and now I see that I am able to visualize in one line all the inferior alveolar nerve. So now I go to nerve. I check where the nerve is entering the bone. Here it is. One click outside, one inside, and now I go to the nerve inside here, and I just have to follow this curve, and the nerve is done. The nerve is done in 2D, but it's also done in 3D. Now if I want to segment objects, I go to into this tool, and I see the bone. What's good is that when I move my cursor, my mouse, I see the Hansfield value of the bone or of the teeth. By default, a 500 Hansfield value is selected for the lower and 250 for the upper. But if you want to make mask of teeth, then the value will be different for the prosthesis, and you can also customize. So let's go back to the bone. I take my by default density, I click, and almost immediately I have a 3D image which has been built up. So I can now remove the volume rendering, and I see my 3D image like this. If I want to increase and improve this, and this is very important when we work on bone with a guide laying on the bone, then I can reduce this. You see that I can fill the area. I go up to the place that I want to fill, and look, I'm working on the left side, and I'm going to change the image on the right side. So I am filling the gap. I am filling the gap. I am filling the gap to make a nice bone surface. So if I want to make a bone guide, then I need to do that over the bone. So now you have a well-prepared image, and then we can also import objects. We can superimpose plastic cast or superimpose a double scanner with denture on one side and the scanner of the bone with the denture on the other side. Let's go to U plan. This is U plan. It's almost the same, but we have orthogonal reconstructions. Wherever I click, I change the click and I change the cut and I change the reconstruction in 2D and in 3D. So if I want to come here, I have my nerve. A good idea would be to build up a wax-up of the tooth I want to replace. So I go to virtual tooth. I can use a symmetrical tooth from the opposite side, or I can use a virtual tooth. I click on the number of the tooth, I validate, and a tooth is coming there. I put it up. I am going to change the position of my tooth, and I'm going to show you this. This is the way to change the size of the tooth in height, in diameter. I can put it in now. Okay. I can just change the position because it's not in the right position. I need to move it back. I need to move it inside. I take that, I take this, and I get my tooth. Okay, so I just go down now, and my tooth is in the right position. It's a little too narrow. I make it wider, and I have my tooth in the right position. I can validate this, and my tooth, the wax-up of my tooth is there, and now I can go to the implant placement. Implant placement is done. You have the history of the implant you want to work on. 46, then I selected all these. I have 10 in history. I selected this. When I click on this, then I see that my implant is turning around on the right side. So if I want to take another implant, another brand or another implant, I can go here, I click here, and I have another side, a kind of implant. So let's go back to my preferred implants for this kind of tooth. I validate, and now in 2 clicks, I am going to place the implant in the right position. 1 click on top of this, and 1 to change the angulation until we have the right angulation for this tooth. Then I can move back this a little. Then I can reorient my tooth in the orthogonal view. Then I can slightly change the angulation and back. And my implant is almost in the good position. If I check this in the 3D, I see that I have my wax-up, I have my implant, and the implant is emerging exactly in the center of the tooth. So the next step is to go to U design. I will not show that today. And U design will allow you to design a surgical guide, and with a certain number of drills and surgical tray, you will be able to exactly drill and place your implants in the right position. Today, the UniGuide system is probably the easiest system existing on the market, and the fastest too, to do that job and to do it in a good way. The patient appreciates this, and the case acceptance is increasing dramatically when you are able to show these kind of things to your patients. So not only the security is coming for your patients, but also your reputation will increase because you are able to do that in a routine way. What I would like to show you also is this. When you have an implant, you can increase the size of the implant, and this is moving here. It goes to 13 millimeter, or you can decrease the size and go to 8.5. You can also change the diameter. This is a 5. You can reduce to 3.5. So if I want to increase that, I go to 5 back. And I don't need to go to any other windows to do that, I can do that on the implant itself. So it's very easy, very simple, and this has been written and thought for implantologists by implantologists. I thank you for your attention.